Hello, welcome back to the channel and watch till the end so you can see the sources and verify everything for yourself. Today's story is causing quite a stir. A popular radio host has been dismissed after publicly questioning healthcare for foreign nationals in South Africa. That incident has ignited a heated national debate, with many asking, are we facing a public health crisis because of migrants using our clinics? Let's dive straight into what happened and why it matters. The radio host, known for speaking his mind, was recently let go after a segment in which he claimed that foreign nationals are overwhelming public healthcare facilities, overburdening systems meant for South African citizens. In one fiery monologue, he warned of doctors and nurses being pushed to their limits, and suggested that foreigners were receiving priority care over struggling locals. His words lit a fuse. Some listeners cheered, while others were horrified at what they saw as xenophobic rhetoric. This dismissal has brought two major issues into focus. First is the state of healthcare in the country: long queues, medicine shortages, and clinics running beyond capacity. Many people know the story: South Africans waiting months for chronic medication, or even worse, emergency cases delayed because system is overstretched. The second issue is whether blaming foreign nationals is fair, or a distraction from deeper problems. The public reaction has been massive. Supporters of the radio host say he was speaking truth to power, raising concerns that many are too afraid to voice. They point out that budget cuts, strained staffing, and the COVID-era backlog have left clinics creaking under pressure. For them, migrants accessing free healthcare, especially those without documented status, is a red line. Meanwhile, critics argue that this dismissal was overdue. They say the host's comments were irresponsible, inflaming xenophobia and potentially endangering foreign nationals. Human rights groups and health professionals point out that the Constitution guarantees everyone the right to basic health care, citizen or not. They warn that if public sentiment turns against foreigners getting health care, we could see people avoiding hospitals out of fear, and that could fuel a real public health emergency. Here's the tricky part: both sides raise valid concerns. On one hand, SAP News has reported clinics hitting breaking point, with a shortage of nurses and cramped facilities. On the other, organizations like Medicine Sans Frontieres warn that turning migrants away only discourages them from seeking care, even for serious conditions like TB or HIV, and that has consequences for everyone. Officials from the health department have said they will hold a task force to examine migrant usage of public health care and its impact. They promise to release data in the next few months, including numbers of patient visits, admission rates, and how many are foreign nationals. That transparency will be critical, because right now we mostly have opinions and anecdotes, not hard facts. Meanwhile, civil society groups are pushing back. They're calling for public education campaigns, not clinic gatekeeping. The SA Human Rights Commission and other NGOs say the key is reinforcing capacity, more budget for health, better training for staff, and more clinics in underserved areas, rather than scapegoating migrants. And let's be honest, the timing of the radio host's dismissal couldn't be worse, just ahead of local elections. It's easy political fodder, and officials are likely watching closely, trying to avoid looking soft on public services or on immigration. All images used in this discussion, clinic queues, hospital halls, radio studios, are for illustration only. They help paint the scene, but aren't part of the actual dismissal or debate. So where does that leave us? We need facts and leadership. If clinics are collapsing, government must act, hire more staff, increase medicine budgets, upgrade infrastructure. And if migrants are part of the patient mix, let's examine what that really means, who they are, what they need, and how the system can meet demands without excluding people based on nationality. In the comments below, what do you think? Did the radio host cross a line, or did he speak a truth we're not ready to face? And should healthcare access be limited by citizenship, or should it remain a right for anyone on our soil? Before we wrap up, here's a light note. I heard someone say the clinics are so busy now, even the chairs are wearing out. Next thing we'll be booking appointments just to sit down. But serious as it is, healthcare isn't a waiting game, it's a right. Thanks for watching. Don't forget to like, subscribe, and keep the conversation going. Stay informed, stay kind, and stay healthy. Sources: statements from the radio station and host, reports from the Health Department, analysis by the SA Human Rights Commission and healthcare NGOs, public reaction captured through social media and listener surveys, and recent health service usage data.